All right. Hello, everybody. Everybody's kind of coming in right now. I'm going to give it about a minute or two, and then we'll get started. All right. Hey, everybody. It's McKay at Patients Rising. I see people still coming in. I'm just going to give it about probably a minute, and then we'll get started. So just be a little patient with me. Thanks. All right. Looks like things are slowing down, so I think we'll get started. First, I want to welcome everybody. This is McKay at Patients Rising. Really excited to do this town hall. First, I just want to acknowledge our good friend and founder, Terry Wilcox, sends her regards. She's unable to attend us this evening because she has a Little League baseball game, and that certainly does take priority in our views. So, but she does say hi to everybody, and she's excited to see everybody at the fly-in. So today we're going to have a busy town hall. Not my favorite type of town hall because it's going to be a lot of me talking, and that's not my favorite part of these. But I'm also excited to say we're going to have a few guests from our team. Jen Garzia, who is helping plan our We the Patients Week fly-in. And then I will do a little bit of an update on what's going on in Washington and what to expect for the fly-in. I know there's a lot of interest around the bills that we will be talking about, so I will get into a little bit more detail as it relates to that. And then we're going to have a handful of our team leads for the fly-in introduce themselves, talk about what they're excited about, and then we're happy to go to your questions. First of all, we're already in summer, and I can't believe that. I really intended to have probably 3 town halls by now, but the way this year's gone, every day there's been some kind of news that's been dropping. And it got to this point where, candidly, I just kept trying to find a stopping point where we could get things settled so we could kind of address some of these issues, and it just was never stopping. And now we're at the fly-in. So I apologize for sort of this delayed town hall compared to previous ones. It was not the intention or the goal, but I think everybody's kind of aware, like the amount of news flow and information and activities has been pretty intense. But it also creates a lot of opportunity from a patient advocacy perspective, and frankly, our fly-in could not come at a more important time. So I'm gonna kick it off and transition over to Jen and let her kind of walk through what to expect during that week. Before I do that, I just want to say, while this town hall will focus on the fly-in, it's going to be our intention is to make it relevant for everybody, even if you're not able to attend in person. So don't feel like you're intruding or anything like that. This is for everybody in the Patients Rising community. So Jen, I'll turn it over to you.
Okay, thank you. Okay. Hi, everyone. Thanks for joining us tonight. I just wanted to get on here and talk about the agenda for the few days that you'll be with us. And whether it's your first time advocating or you're a returning voice, we just want to make sure that you feel confident, prepared, and supported. So the first day or the first event will be on Monday, June 9th, and it's a welcome reception. It'll be 5:30 to 8:30 at the Stand Together lobby. And all this stuff is on our circle page as well. It'd be a casual night, so feel free to dress in business casual. You'll meet your fellow advocates and the rest of our team. There'll be gluten-free and vegetarian options for food, and we're going to have a haiku poet who will be there to custom make your poem based off of your patient story. So we're really excited about that. I think it'd be a fun experience, and we'll have Jessica taking some photos and some videos to capture that moment. Then we'll walk into Tuesday, June 10th. That'll be our legislative education day. We'll be at the Boston Exchange, and that's right down the street from the Hilton where most of you guys are staying. I think it's about a block away. It's within walking distance. It'll start at 8 a.m. It'll go to about 4 p.m. It'll be on the second floor. We'll have breakfast, lunch, and some snacks with some great drinks as well. We'll have training, the briefings, we'll do some meeting prep. Again, we'll have gluten-free options, vegetarian options. Then we will offer bus transportation from that building at 5:30 to go over to the U.S. Postal Museum that's going to host our next event, which will have live music and we'll have great food. We'll have some drinks. We'll also have the haiku poet again. We'll have two of them. So we really will encourage you guys to use the poet to get your story out in a different way. And then there will be bus transportation back to the Hilton Hotel about 9 o'clock at night. And then we will walk into, let's see, did I forget anything about that? Oh, the galleries will be open in the museum that night, and they're fabulous. I'm so excited to see them. I don't know how many have seen the U.S. Postal Museum, but you'll go down the escalator when you come in, and you'll be in the atrium, and it's fabulous. It has like the airplanes hanging and the stagecoach, so there's a lot of interactive things to do there and keep us all busy and engaged. Um, and then that night, we'll get a good night of sleep, everyone, and we'll walk into a 7:30 a.m. pickup at the Hilton Hotel for the bus will pick us up and take us over to the Capitol steps for our group picture. And then everybody will start with their morning meetings. We will have a lunch in the Rayburn room 2261. Again, we'll have gluten-free, vegetarian options. It'd be a box lunch. We have some good salads coming in too. And don't worry if you're a few minutes late or we're very late. We'll be there for 2 hours during that lunch period. You're welcome to come in and out and get what you need. Then you continue on with your afternoon meetings. And then that night, we will not be providing any transportation to the baseball game, but we will all be there starting about 6 o'clock. The game starts. And this is the only time, everyone, that I'm encouraging you to, if you have any dietary restrictions, I'm unable to offer anything outside the normal baseball food in that arena. So please bring your own or maybe come full. But there will be food, but it's nothing that I can offer with gluten-free or vegetarian. That's not something that was available in that setting. But we'll have foam fingers and we'll have a lot of good space for everybody to see the event. And then that night, we will have a bus that will take everybody back to the Hilton, to Arlington, because I know it's going to be jam-packed. So also bring your patience for when you're going through security at the baseball field there. It may take a while. If you're able to come a little early, I don't know when your meetings will end, but that's not a bad idea either. But just take your time. It's worth getting through the security line. We'll have a great room and a great space for everybody to see the game. We'll have lots of goodies for everyone. We've got some tote bags coming with pens and books and all kinds of good stuff. We'll have t-shirts. We have clear backpacks for everybody to take into the baseball field if they need them. We will have, I think that's all we're giving away. Yep, looks like it. And then if anybody needs any kind of wheelchairs or anything that I haven't mentioned, please let me know. I will have wheelchairs available only inside the Capitol, and I'll have to rent them for you, but they won't be able to go outside the Capitol. So it's just in those halls. Everything is accessible. The buses are ADA accessible. So but if anybody needs anything that I haven't mentioned, please just email me. I'm happy to look into anything for you. I think that's it, McKay. Unless anybody has any questions, I'm happy to pause and wait for questions.
Jen,
Yeah,
I
we
have,
can.
I
Oh,
have a
God.
quick question. For those that aren't staying at the Hilton, because I'm actually going to be staying closer to the Capitol, what time do we meet for the group pick at the Capitol steps?
That one's
Approximately.
8:30. Thank you, Michelle. Good point. The Capitol steps at 8:30 is the picture.
Okay, thank you.
Yeah, let me just add, and if there's questions, feel free to hit the Q&A, or if you're brave enough to raise your hand, you can raise your hand. But um, a couple things too. So we are trying to take some lessons learned and some feedback as we always do to try to make this as good as possible. So we have started our outreach to team leads who will be working with different teams for the various states. They're going to start their outreach to their teams. So, because some piece of feedback that we've gotten is teams would actually like to meet in advance just to get to know each other, kind of plan and stuff like that. So we are trying to do that, as well as we're doing this now to offer sort of a pre-education, and I'm open to doing another one if that works, and we'll have a couple of other touch points for, during, and after as well. But one of the other points that I wanted to make too is that we will be having, sorry, I lost my train of thought for a second. That we're going to be using different programs. Some of you will be familiar with it. We're working with an organization called Advocacy Associates. There'll be an app, there'll be a link. You'll have your team there. There'll be resources and materials. So we're working on finalizing some information, and those links should be going out to you soon. And really kind of the delay is we're in this place where they're working through the schedules for particularly the meetings with the members of Congress. And it just so happens, just as we planned, I think we're going to be there one of the busiest weeks of the year. So anyway, I'll pause there. If anybody else, Lucinda, I saw you had a question. Go ahead. Lucinda.
It looks like she's still on mute.
I could read the question for you. It's can we email the address for the name of the Hilton where everyone's meeting at, and also the name of the address and address of where the meetings are happening at the Capitol.
Yes, of course, and they are on Circle, but I absolutely will put it in the chat right now too.
All right. Okay. Yeah, looks like we have a couple of questions. What type of bag can we carry to the Capitol?
I'm pausing because have not been told that there's any restrictions going through the security at the Capitol, although I would use best judgment.
I've
I would not.
backpacks like
Yeah, I've seen backpacks. I've seen wagons go through with kiddos and the stuff they need.
Yeah,
Yeah.
the Capitol you'll be okay. There shouldn't be. I mean, I wouldn't recommend bringing a firearm, but other than that, I think you'll be pretty good. I will say lines to get into the buildings have been growing. So typically once you're in, especially if you're on the Senate side or the House side, and that's kind of where all your meetings are, that's typically good. Where it kind of becomes a pain is like first meeting of the day, or if you have to move from the House to the Senate, that can be a little bit of a pain. But so just be aware of that. But typically, there's little security. It's you have to go through a metal detector. It's easier than TSA. Depending on the Capitol Police, some will make you take off your belt, some won't. I don't know why, but that's it.
It's more tricky going through the National Stadium for the baseball, and that's why you'll have the clear backpacks if you'd like to use them. I would suggest using them. It's a lot easier. But yeah, the Nationals Park is a little bit trickier than going through the security at the Capitol.
All right. Let's see. Are we going to meet with senators? So we are working. Oh, that was one of the other things I was going to raise. So I know we're going to try to do, the team photo. Well, we are going to do the group photo. But as it turns out, there's going to be a couple of senators as well as some House members. Most of them are in the morning. I think there's one, maybe two in the afternoon, where they're going to do sort of like constituent coffees, and we are working to make relevant, meaning you are in their district or affiliate in their state, whatever that might be, with those. So yes, those will be opportunities. We are working now on our invites to various members of Congress for a variety of different events. It's very hard to get members of Congress to Arlington, and especially when we're there, we're going to be in session. So we're not just to set expectations. We're not going to be in Arlington, but we're certainly hoping for Postal Museum, baseball game, those that aren't playing, as well as when we're at the Capitol during lunch. So we're definitely working on that, as well as, in some cases, we are able to get in-person meetings with members of Congress. Usually it's with staff, but sometimes that does work out. I will be candid. I think we will be there when the Senate is in the thick of big business. And I do think this will be the year where it's probably most difficult for us to have access to the senators in particular. So don't take it personally. It's just a very busy moment.
I'm having a little trouble posting to the group in chat, but I just want to let everyone know it's the Hilton Arlington Ballston. And I'll try to get it out a different way later or through a circle post.
All right, so Dorothy asks, is it all right? Yeah, team leads can definitely reach out if you know who your team is. I know we were working on getting a comprehensive email out to team leads that gives you kind of the materials you're looking for, as well as addresses. But if you have the information and you're ready to go, please go ahead. Again, even if you're not completely up to speed on some of the policy stuff, that's okay. I think just starting to build the rapport, especially for new people, first time, I think just kind of walking through the process of what to kind of expect in the meeting is helpful. All right. Any other questions? Oh, I think I may have, if I just accidentally got rid of one, let me know. Let's see. Has everyone, oh, aware on Circle is the schedule.
I was going to say, I've created a PDF that will be posted in Circle shortly, and we'll have it up on the website. We'll also be sending it out. It's going to have the schedule, what to expect, going to have like some tips for you, sharing your story, things like that. So we do have more information coming.
And right now, under the fly-in fact, start here. If you just scroll down like 2 or 3 paragraphs, you'll see the schedule at a glance for right now.
Okay, and so the question on when will we hear from team leads? Can we get a list of the team lead names? So we're working through this right now. So this kind of funny thing happens right before the fly-in where some people can't make it and stuff like that. So in certain cases, we're having to reassign some team leads. Everybody will have a team lead, but if there's a little bit of a delay, it might be because there was a change in someone's schedule personally or something along those lines. So we are doing our best to try to get the communication initiated now, but in some cases it might be another day or two. So just please be a little patient with us. We're trying our best. All right. Any other questions? All right. Well, I'm going to move on to the next piece, and I'm going to use slides for this because it's a little intense, and I'm not a huge slide person, so. So first thing I want to say, as I go through this, one thing I absolutely love about Patients Rising is, we truly have, I think, a great representation of sort of the patient caregiver community all across America. And so with that said, and I say this because I know that there's a lot of things in Washington that are happening right now. A lot of things are moving. A lot of things are confusing. I'll be honest. Some days I'm not sure I understand what's going on myself. But we do, one thing I love about this group is we do have people from all over the country, all different views, all different beliefs. Some people really think what's going on is exciting right now, and I've heard from others that are really confused and a little nervous about what's going on right now, and then everything in between. And so I do my best to try to present things in a way that it provides context, that is accurate, that's I do my best to really just kind of present things as are and just kind of give it to you straight and not really try to like influence one way or the other. So I just say that to say I am mindful that people are coming from different perspectives, and we think that's great. I mean, one thing we like about Patients Rising is we're very open to discussion and debate and thinking about these ideas because it's very complicated stuff. So with all that said, I'm also going to say I'm going to talk about a bill that's going through Congress right now. It's a 1,000-page bill, and I I I don't know every aspect of this bill. It's 1,000 pages, so I will also try to represent that to the best of my ability. So I just would appreciate your grace and assumption of best intentions in there as well. Um, so I want to talk about this process that's going on that's called reconciliation. You may have heard about a bill that passed the House last week, and most of the reporting will come in one of two ways, typically. And if I subscribe to just about everything email wise, so my inbox is either getting um, Medicaid is getting cut, and then on the other side, it's we have a bigly and beautiful bill, um, and there's a lot in between that. And so I want to try to dissect that a little bit so people can kind of understand what's going on because it's not just as simple as a couple of bullet points. So first of all, what is reconciliation? It is a budget process. I would think of it more as like a long-term budgeting process. And it's sort of a special process in that it fast tracks the normal sort of congressional process as it relates to budget. The big thing about this is typically in the Senate, it requires 60 votes to end debate and move forward with a vote. When you go through this reconciliation process, the big thing that's different here is you only need 51 votes. And so this has been a tool that, again, it's really focused on things that are mandatory federal spending. So that would be things related to Social Security, Medicare, Medicaid, for example. It's dealing with things like revenue, so tax policy. It's also dealing with things like the debt limit. And I think that's one thing that's really important to understand because this bill has to happen. And the reason it has to happen is because we are in a place where we are reaching our debt limit as a country. And it is expected we will no longer be able to borrow and pay our bills somewhere between September and October if Congress does not take some kind of action. So I want everybody to be clear about that because I know when the reporting is happening on this, it can come across very much like a lot of the reporting is not putting this in context of something has to happen as it relates to the debt limit. And so this isn't unusual. It's not the first time this has happened, but the country does have to pay its bills at the end of the day. And so that's what a lot of this is actually going to be focused on. There is something called the Byrd Rule, and what the Byrd Rule does is it allows members of the Senate to challenge things in the bill. So this bill that was just passed from the House is now going over to the Senate, and the Senate's reviewing every aspect of this bill. And what will happen is different members of the Senate will challenge different measures. And it could be people from either party. In this case, I would expect because the Democrats are in the minority, they will be the ones most likely to be challenging different aspects of this bill. And when you challenge this bill, basically it's saying, well, this particular measure is not particularly focused on mandatory spending or revenue. It's not the fiscal impact's not that significant. And so the challenge will be taken up and the Senate parliamentarian actually makes the decision on whether or not it should be allowed to stay in or not. So what I'm saying is the House passed a bill That bill's is now in the Senate. They're reviewing it. There's two things I know. Number one, several things are going to be challenged as it relates to that bill. And number two, the Senate never believes the House does anything right, and they always do it their way. And so that's not a party thing, that's a Senate thing. So I would not necessarily I think it's highly unlikely that anything the House passes what will be moving forward. There's different beliefs in the Senate that there should be one bill, two bills. This is things that are like weird Senate rules. And bottom line is this is going to be very much a dynamic situation kind of going forward. I wanted to give just a kind of a brief history of reconciliation because I do think this is important context too. This is a process that started in 1976, and it's happened under every single president since President Carter to President Biden. So this is not unusual. The one thing that is interesting, and I didn't know this until just actually today, reconciliation actually happened almost every single year or every other year in the 80s. And then what we've seen is decade by decade, number one, it started to decrease, but it's also become more of a partisan legislative strategy as the decades have gone on. So originally, you actually would see, like, with Reagan, it would be a Republican president, frequently a Democrat, Senate and House, and they'd be working together on long-term budget issues. Now we're seeing less frequent reconciliations, and they tend to be obviously still focused on the fiscal piece, but they tend to be a little bit more partisan in nature. And so it almost anymore you will not see, and I think this is actually kind of a tragedy. I'll be completely candid. I would not expect there to be a bill that goes through that has a single Democrat vote because the Democrats are in the minority. And because of the Senate rules and you only need 51 votes, that is what it is. And that's what happened when Obama was president. That's what happened when Trump was president. That's what happened when Biden was president. And that's what we should expect when Trump's president again. I actually think we should be encouraging members of Congress to work on this in a more bipartisan fashion because I do think, candidly, we tend to focus fully on healthcare stuff, but I do think there are some real structural issues related to our spending. The deficit has been growing about $2 trillion every year for the past 2 or 3 years. So, and that's not even the debt. So there are some concerns as it relates to that. So I want to move on to what is in the bill. It's called the One Big Beautiful Bill Act. I did not name that. That is what it's called. And it's really passed. It's passed in the House last week. It does focus on defense spending, energy policy. Those are not my areas of expertise. I will not be addressing those at all. And then it also focuses on health and social programs. There's some things in there that have not been talked about at all as it relates to health savings accounts. Something that's called an ICRA, individual coverage reimbursement arrangements. I'll talk about that a little bit more later. Some rural health care stuff, some PBM reform, orphan drug exclusion, which has been actually a pretty big deal. So that they've been sort of, well, the view from industry is that they've been improperly treated as it relates to the Medicare drug pricing negotiations. And then a lot of things as it relates to the Medicaid expansion, a little less on the traditional Medicaid. And just to kind of give people some perspective, because I think this is important too. So traditional Medicaid is what most people think about when what it is Medicaid. And so that's typically people that are disabled, medically vulnerable, pregnant women, very like below poverty line people. I feel like I'm forgetting somebody, but it's sort of the disabled, most vulnerable that we're typically talking about. With the Affordable Care Act, it allowed states to do what's called the Medicaid expansion. And so these are people that are above the federal poverty line, but they're still considered lower income on the spectrum. And some states have decided to expand Medicaid. Some states have decided not to. And then you have some states like Wisconsin, which are kind of interesting because they decided to sort of do it, where they went kind of, I think it was slightly above the poverty line or just about. So different states can treat it in very different ways. And that's one of the complex things about Medicaid is while there's a federal funding component, it's the states that are administering it. And so that makes Medicaid incredibly complex because it's not just the federal policy. You have to understand the policy of all 50 states. And I will also admit I don't have my head around all 50 states. I also want to share this too. So this is sort of public sentiment towards Medicaid. 3 in 4 voters view Medicaid favorably. And that includes 61% of Trump voters, 72% of swing state voters. Nearly all Americans say that it's important that as many Americans are covered by health insurance as possible. 70% of voters oppose Medicaid cuts to pay for tax cuts, and 46% of voters have a personal connection to Medicaid. So I'm sharing this for a couple of reasons. Number one, the public has sort of spoken on this topic. And the second thing I want to share is that these are all data points. These are all public opinion polls that actually came from Republican pollsters in a Republican strategy memo. And so this is the data that Republicans in the Senate are really looking at. And you have this interesting dynamic right now where certainly you have elements within the Republican Party that are very concerned about the spending and they do want to rein it in. But you also have a lot of people who they don't want to touch Medicaid at all. And that's why I don't know how this plays out. I'll be the first to say it, but I also think it would be it's unfair to jump to conclusions on this topic too, because I think there's a lot of sentiment that this is a risky area to touch. And how they navigate this, I don't know, because they do have to address in this reconciliation package, basically what's considered like the entitlement program, so Social Security, Medicare, Medicaid. So it is a complex topic to kind of navigate. So I want to talk a little bit about our strategy for the fly-in. And we've netted out in a little bit of a different approach than what might be expected. And this came about because, well, first of all, back in February, when the initial sort of news came out that on how Congress was going to be approaching this, number one, I learned that I needed to learn a lot more about Medicaid. And so I've been working with a lot of folks on our team. I've been talking to a lot of individuals in our community who are connected with Medicaid to, better understand it, because I will admit, like probably just about everybody in Washington, D.C., I don't know enough about Medicaid as I'd like to admit. And they're all guilty of this too. So what we did is, number one, our priority has really been to focus on ensuring that we not just protect, but strengthen Medicaid for the disabled and medically vulnerable. Now, I will also say what I've learned and what we continue to learn is we have a lot more work to do to understand how we can really kind of improve it. And so we're not really in a position at this moment to make a kind of a big stand as it relates to what we think Medicaid should look like going forward. But that's actually something this whole process has actually kind of inspired us to think about this issue a lot more going forward as something we want to talk to this community about. But the other thing is, this issue is what I think we would classically call a defined issue. America has kind of spoken on this topic, and trust me, every member of Congress has heard from the patient advocacy community as it relates to Medicaid. They are not looking forward to meeting us because they assume we're going to beat them over the head on Medicaid. And so what we view is we're not going to get much more traction by talking about Medicaid as the issue at our particular fly-in. Where we're going to get more traction is kind of looking for the opportunities that align with the agenda that we've typically been working on in our previous fly-ins. And the nice thing about this is there are areas for common ground. As I showed you guys, there's areas around health savings accounts, around PBM reform that we like a lot in this bill. And so where we kind of netted out is those of you that have been involved in patient advocacy or lobbying for a long time, that like getting wins are hard. It's a long day's work. Sometimes it can take years. I was thinking about a patient advocacy group that I know that's been working on the same bill for 10 years. They've gone through 3 different presidents. They've dealt with majority Democrats. They've dealt with the majority Republicans, and they still haven't gotten this thing done because it's hard. The stuff's not slam dunk, and so I think we want to focus on racking up the wins where we can, and we see a lot of opportunities to do that, and a lot of opportunities to add for ways to improve this bill that can have a meaningful impact on patients going forward. And so we're going to propose that we take a step to move away from what we can't control and focus on the areas that we can control, and particularly the areas that have been the strengths of the organization going forward. And because this reconciliation bill is taking all the oxygen out of the room in DC, we are going to acknowledge what we like about the bill. We are going to suggest what we can improve about the bill. But we are going to have a list of things that we would like to propose that we follow up with members of Congress on in the fall when they get back to regular order. So that's kind of our approach on this. I do kind of and I know we're kind of running up on time, so I'll try to move through this pretty quickly. But areas where we have common ground, so there's massive expansions as it relates to health savings accounts. There is major value add to seniors who are Medicare Part A. Bronze high deductible plans in the ACA become HSA eligible. There's increase in contribution limits, catch-ups, et cetera. And then one thing that I'm really excited about is it expands eligible expenses to include things like direct primary care, but even more importantly, I really like the allowing it to pay for fitness club memberships as well. And then ICRAs, I'm not going to touch on for this meeting, just in the interest of time. Other areas where we have common ground, everybody knows pharmacy benefit manager reform has been a big issue that we focused on. In this particular bill, it does allow delinking of PBM compensation from negotiated rebates. So those of you that are not familiar, the pharmacy benefit managers, they're the middleman between your health insurance plan and you basically, and they work to negotiate with drug manufacturers a discount from that list price. Historically, how this has worked is they claim that they pass it along to the payer, which would be the employer or the government or the union, whoever's the payer of the actual health plan. But it's not been particularly transparent. More importantly, those savings had never been truly passed on to the patient themselves. And this starts to fix that process where patients can participate more in the savings because it's holding the health plans, the PBMs more accountable, as creating a more straightforward dispensing fees, so they can be paid, but not based off of the actual negotiated rebate and discount. It also gets rid of, in Medicaid, something called spread pricing, which is where they will charge your health plan more for the medicine than what they will reimburse the pharmacy. There's also aspect on rural emergency hospitals. This is very important for rural healthcare, particularly in areas that have lost hospitals. I'm not going to get, just in the interest of time, I'm not going to get into much detail on that one right now beyond that. So where can we improve this bill? First of all, we're excited about the HSA expansions. We'd like to see that move forward. We think that this is a proposal that would have support moving forward. But we also think that we can improve it by expanding an HSA option to low-income individuals. Those of you that were with us last year may remember that we got behind a bill called the Access Act. And we think actually this reconciliation bill is a really great opportunity to insert something like this, if not this actual bill itself. And so what the Access Act does, it's really cool. So it's for people who are at the poverty line or just above 100% of the poverty line to 250% of the poverty line. If they are enrolled in the exchanges in the Affordable Care Act, they are already getting a cost sharing reduction subsidy to lower sort of the price of those health plans. But what this proposes is it takes a portion of that subsidy and it enrolls it into a government-backed HSA. And so it's a cool concept because rather than directing money towards insurers, which we constantly see issues where it's funding the third party, kind of always result in some problem at the end of the day. We're actually funding patients and we're giving them more flexibility to decide how they want to use that money, how they want to participate in their own healthcare. They could use it on medical expenses today or save it, invest it for an expense that's later on down the road. This is also something that would provide a new access option to 5 million lower income Americans. And there's already bill language there. And the other great thing about this is the Congressional Budget Office, which does sort of the forecasting on these things, has already estimated that not only does it improve access options to lower income Americans, it would actually reduce the deficit by $30 billion over 10 years. So that's something that's kind of a win in multiple categories that would be an enhancement to this bill. The other area where we can improve is those of you that have been with us for a while know the good old quality adjusted life year. This is an economic health measure that's been around since the 1960s, and it should have stayed there. It is not fit for the 21st century. It is the math is a little suspect, to say the least. It's assumption based, but at this point in time, it's pretty well established as a tool that's pretty discriminatory towards the elderly, the disabled, and the chronically ill. In other words, the people who need healthcare the most. This is something that is being used in Medicaid, and it is being used by the VA. I would say the VA is very proud to use it. They promote it on their website, and it's something that we've historically had a major problem with. We have been working on a bill for several years that's called Protecting Healthcare for All Americans Act. We are working on getting this reintroduced right now. We've had very productive conversations in both the House and the Senate. It just hasn't been introduced yet. So we have to kind of rely on last year's bill. But we think that this is something where a statement can be made about supporting the disabled and medically vulnerable community in Medicaid. And so we want to encourage this to be part of the process as well. All right. So for the fly-in, what we're going to do is we will have a document that basically says, this is what we think is good about this reconciliation process from the healthcare perspective. And then these sort of items that we think we can improve, the Access Act and the QALY ban. The other thing we're going to have is a second document that is, again, it's other bills that we support, but they're not going to be appropriate for the reconciliation process because of the rules around that particular process. But it's a great opportunity to say these are also bills that we support, and we would love to follow up with your office when you get back to regular business in the fall, let's say. And so we can try to create another opportunity to meet with members of Congress on these particular bills. They're fairly similar to some of the things that I've already outlined. And unfortunately, I will have to go through this a little bit quickly, but I'll work on finding other ways to kind of share this information because I know a lot of people are kind of interested in this. The other thing I will say is for the fly-in, I do not expect anybody to have all of these bills memorized or anything like that. I want to take the pressure off right now. The one thing I will ask though is, do any single one of these bills resonate with you? Are you able to take your story and apply it to any of these bills? All you need is one. All you need is one. And that's the other thing that we tried to do this year is it's a little bit more of a choose your own adventure. So we are going to have more bills, but like I said, I don't expect you to talk about every single one. But I wanted people to feel passionate about the thing that they were getting behind. And so we wanted to provide a variety of options that can fit with your story and fit with your passions. I see I have a couple of questions. I will pause for a second. Bill, would you mind helping me with this?
Okay, do you need help? You want me to read the questions for you, or?
Oh, are they? Oh, yeah, I don't see anything.
I think I see. I think Dorothea asked about one-pagers being left behind at meetings.
Yeah, so we'll have two documents. One will be kind of what we like about the reconciliation bill and how we think we can improve it. The other one will be kind of a two-pager that outlines a handful of bills that I'm trying to go through in a second, but it'll be around expanding health savings accounts. It will be benefit manager reform, pharmacy benefit manager reform, vision benefit manager, dental benefit manager. It will also be something related to charity care and nonprofit hospitals, and then a couple of other priority review voucher for the rare disease community. And what is the last one? Oh, it's a med tech bill that's focused on new reimbursement pathway in Medicare.
Okay. Lucinda asked, can you email us a bullet point list of the bills we support so we can research them to get some?
Yes. Yes, we are working on that right now, and I think we will have a package that will be going out soon. Any other questions? I am going to pause a second. What I want to do, I'm going to break this up for a minute. I'm going to step away from the bills because it's probably a lot anyway. Charlene, actually, I'll go to you. I can. Here we go.
Okay.
Charlene, can I hear you?
Hi.
Okay. How you doing?
Okay. So, yeah, I guess my question is a follow-up to being able to review what our interest is with regards to our story. And the one that you had up, I'm not sure if that was the name of the bill, but I wanted to know more about the
Was it the first slide or the
discrimination.
second one?
Yeah,
Oh,
this
this
one here.
QALY?
Yeah, this
Yeah.
quality adjusted life year.
Yes.
Can you give me just a little bit more background? I can probably research some of it on my own, but
Yeah, no,
I know you
and
said something about the poverty level with regards to Medicaid and how that's changed. Is that pertaining to this?
so that's a different bill. So that's the one before this. And yeah, you're right. I'll slow down a little bit because I was going fast. So the first bill, this is a new idea. And the idea is that for a group of people that are at the poverty line or maybe just above 250% of the poverty line, we'd give them an option to go into the Affordable Care Act exchange. They can pick a plan that fits their needs. And as part of that plan, they would be given the option. They can do it the traditional way, the way that's currently done, or they could choose to take a portion of that subsidy. It's 1/12 of that subsidy, and put that into an HSA. And again,
Oh,
they can
okay.
use it for out-of-pocket costs. They could use it for well, if the big bill goes through, potentially gym memberships. You could save it. You can for rainy day type of thing.
Oh, okay. That's not what I'm interested in. Did you say something about Medicare? Because
Yeah.
Medicaid
So
is income based. So if you don't qualify for Medicaid, because of your income, then you would be getting Medicare. So would this work hand in hand or no?
So the bigger bill is trying to expand health savings account. So health savings account have a lot of restrictions on them right now. And so only
Okay.
a small group of people can currently use them, and we're trying to change that. We think that everybody should have access to a health savings account, irregardless of your income, everything, right?
Okay.
Everybody should have one.
Okay.
So some of this bill is starting to address that. Actually, another bill that that is in our packet is a bill that's called the Hope Act, and it would actually expand access to health savings accounts. I've heard this number. I don't know it for a fact, but I've been told that it's roughly 92 to 93% of Americans. So virtually everybody would have, if you're on Medicaid, if you're on Medicare commercial plans, it would give you access to something. Well, it's like an HSA. It would be called a Hope account.
Okay. Okay. Because I'm here in Cleveland and right now, my co-pays are what's astronomical that I would look to see what's happening with that as far as so as HSA would be an opportunity to have that pay for your visit, for your copay as opposed to out of pocket when you have the Medicare.
Correct. Correct.
Okay. Okay, so I
Correct.
guess I want to know more about that then. Okay.
Okay. Yeah, and I'm happy. Listen, I know I'm presenting a lot of information. We'll continue to share. I'll be very repetitive over the next few days and weeks. Um, but I'm happy to take the time to help people understand, any aspects of this because listen, it's not easy. I get it. Let's see.
And what was the other piece that you were saying that would help people that are rare disease and disabled and the veterans? Was this the same thing, this HSA expansion?
No, so that's this. So there's this health economic tool that's called the Quality Adjusted Life Year. And it was designed by health economists in England, actually. And then it sort of became a big thing in the 80s to manage healthcare costs. Now, the problem is the way it manages healthcare costs is it kind of rations the care. It kind of gives unfavorable coverage decisions. So if you have a particular chronic condition,
Mhm.
it gives everybody a life score, and based on your ability to get back to perfect health, it will determine how cost effective that treatment is for you. Well, most people that have chronic
We're not gonna
diseases
get
or
better health.
correct. So that's fundamentally the problem with this, and so this is something that we've been trying to ban in all federal health programs, Medicaid, Medicare, VA. It's sort of it's not really allowed in Medicare already, but there are some exceptions to that. But generally, it's not allowed. But Medicaid and Medicare, sorry, Medicaid and the VA, it's definitely a big problem. And this is something, and this is why I went through this one a little fast because this is something that actually was the reason Patients Rising got started. So this is something we've been
Okay,
talking about for a long time. But
okay,
but I'm definitely happy to talk about this more.
okay, okay.
All right.
So now with regards to your story, are you saying that we should look at some of these to help develop our story, or this is only if you're interested in doing the story?
So this is what I'll do. So what I'm kind of asking is this, and I have another set of bills too, that are a little bit more broad, could touch different topics. And what I'm just asking for if any one of these bills particularly resonates to you, or you could tie your story to it, that'd be awesome. That'd be an opportunity. But why don't I take a minute? I'm going to turn it over to some of the team leads for a second to actually introduce themselves and talk about a little bit of what to expect next week, talk about their style, talk about what they're excited about, and that may help answer some of these questions too. So,
Okay.
Jessica, why don't I start with you?
Well, hey,
Yeah,
oh, I didn't know if you needed to change your screen or I can just talk with
I
you
can do that.
here. That's fine.
Mm.
Well, hey everyone, I am Jessica Baladad. This is my third fly-in, and it's I love Hill Days. This is my favorite, I don't want to say favorite day of the year, but as far as advocacy is concerned, this is my favorite event of the year. And what brought me into patient advocacy is that I'm a 6-year breast cancer survivor. A self-exam saved my life, and I just saw the atrocities of what my peers went through. I was 33 years old when I was diagnosed. Screenings start at 40. I had to jump through hoops with insurance. I saw my friends have issues with PBMs, and just everything I've learned through Patients Rising has helped me be a better advocate so I can serve the breast cancer community, especially the young breast cancer community, as it concerns, hospital bills, transparency, and things like that. So I am most passionate about helping you tell your story as it relates to policy, because I know we're all so nervous about that. Policy feels big. Our diagnosis feels so big. And when you put those things together, you think, oh my God, this is very vulnerable. I don't want to sound dumb or stupid, but I know that change needs to happen. And I want to make sure I can communicate with confidence and clarity. So when it comes to sharing your story as it relates to policy, if you want to reach out to me, I'm Jessica at patientsrising.org. You can also hit me up in Circle as well. Please, I'm giving my phone number out to people too. So that's what I'm most excited about being here. So if this is your first time on the Hill and you're going to advocate and talk to your congressional members, like I said, your diagnoses feel so big, but I want you to think about the part of it that caused you the most, not just physical pain, but the biggest pain in the rear end as you were navigating it, your care. In addition to all the symptoms and side effects and treatments that you were going through, what was the biggest part of that as it relates to the healthcare system? What was it big? What resonates with you? How do you what was that like for you? And then as we give you access and information about the policies and talk to about it more, get curious about that because that's going to help you formulate your story so that you can communicate it with your congressional member. And oh yeah, I'm from Tennessee, if you couldn't tell from my Southern accent. So yeah, go Vols.
Yeah, Michelle, why
Okay.
don't I turn it over to you?
Okay, sounds good. Hello, everyone. I'm Michelle Reyes. I'm from Frisco, Texas, but you won't know it by my accent because I grew up in Michigan and I still have my Midwest accent. Um, I got to Patients Rising through my work with the rare disease that I have. I'm a two-time cancer survivor, and due to that cancer, I acquired a rare disease called hypopara. I also came to advocacy because my previous job before working for the Hypopara Association was in the pharmaceutical world. I worked as a sterile compounding tech, and I was very into in that area working with PBM reform. And then I started to realize, even though I was already a rare disease patient, I never put two and two together, that while PBMs affected my job, working in the pharmacy, they also affect patients. And I began to learn more and more and get really wanting to work at the state level on PBM reform, which, by the way, Texas finally passed a very tiny bill on PBM reform this week. But like McKay said earlier, you got to take all the wins because you don't move mountains in this world. I will tell you that about advocacy. You move little tiny chunks at a time, and you have to take those wins and be grateful for them. But as I got more into PBM reform, I found Patients Rising and wanted to get involved that way. There are over 7,000 rare diseases out there. And while we can't even expect our doctors to know all of them, Congress knows even less. But it's not important necessarily the intricacies of your rare disease when you're talking to Congress. It's more about, while each disease has unique qualities, most of us are all affected by the same inefficiencies of our broken healthcare system. So what can we do as a patient to affect the change in the healthcare system, not about the change necessarily for our specific disease when we're talking to the Congress people. Something also I like to talk to people about after my first fly-in, Terry said to me before I did my first fly-in, don't go in with any preconceived notion of a member based on their party. And I thought, I took it in, wasn't really sure, but I thought, okay. There was one particular member I was apprehensive about meeting with, saw them on my list and thought, oh my gosh, I can't stand that person. I hate their politics. I'd made some preconceived decisions based on bills they voted on without really knowing why they voted the way they voted. I want to come at you now and say, at that meeting, changed the way I approach my advocacy now. It was probably the most productive meeting I had of my first fly-in. That congressperson stayed longer than we were scheduled for, gave us some suggestions on things we should fight for, told us about a healthcare bill that they were working on. That was almost like a universal healthcare bill, but it was refreshing to hear that they actually really did care, that they thought outside of what you see. And they were very productive and asked questions back and forth where you will see sometimes if this is your first one, there are some meetings where, first of all, you're going to meet with staffers instead of the actual Congress people, but even when you're meeting with staffers, they kind of are like, yeah, and they don't really engage in a back and forth. So I think it's important to go into it with that knowledge and find ways to kind of push them to answer your questions versus maybe just running through a speech and then stepping back. Learn how to engage with them and don't be afraid of them. They are humans too. And so I look forward to engaging in fruitful conversations with both you and my Congress people. And don't worry about their political affiliation. They're all humans and they may have a story.
Thank you, Michelle. I really appreciate that. And I couldn't echo that more. I always say, and you'll hear me say this multiple times, listen, I respect everybody's opinion. And listen, your vote is your vote. Please vote for who you want to vote for. But when you go to these meetings, check your personal politics at the door, because it really does make a difference when you go into this with an open mind. It is true. Like the best experiences actually come from the offices you never expect. Bridget, I'm going to turn it over to you.
Hi, everybody. My name is Bridget, and I am the team lead here in Colorado. And I used to live in Georgia, so yay, go Vols. I have friends and family in Tennessee as well. Um, I am here to help you guys learn to find your voice. My hobby is actually harassing elected officials. So I'm really good at it. I have no problem doing it. And they are human, as been said. And you would be very surprised when you check the personal politics and you just go in and talk about issues, how much you can actually accomplish. You would definitely be surprised who is supportive and who isn't. Um, it's been one big surprise game. I have multiple autoimmune diseases and genetic disorders that are rare. So I have been in this space for quite some time, and it's a never-ending issue, very complex, but I have experience with PBMs, QALYs, and all sorts of stuff. I'm kind of the anti-QALY queen here in Colorado. And we also passed PBM reform this year. So very excited about that. If you're on my team, you have a message from me in your inbox. So definitely let's schedule a time to speak. And if anybody has any questions, just let me know. I'm always here, whether you're on my team or not. And I'm looking forward to helping everybody find their voice.
Thank you so much. Thank you. Any other, listen, I know there's questions that are coming on the Q&A. I'm trying to answer those live, but any others that want to ask live questions really quickly? Oh, Shirley. First, before you hop on, let me just say one thing too. I know we're a little past the time. If you have to leave, you won't hurt my feelings. On the flip side, I'm also happy to stay on for till like 30 minutes longer. Also, if it helps. So again, if you have to sign off, you won't hurt my feelings. But happy to stay on with you too. And that goes for the speakers as well. Charlene, go ahead.
Okay, so you were saying these team leads, how are the team leads divided up? Is it just gonna be, someone, or are they working on specific bills with us, or do
So
we have
most
something in common, or how is that being done?
Yeah, so most everybody will be divided by state. In certain
Right.
cases, like I'll use Florida, for example, where we have a lot of people coming from, and it's a very large state. We may separate Florida a little bit, but generally speaking, everybody will be focused on their state. And then I personally, we tend to be an organization that likes to let people, like every group, have their own personality. So I defer to the team leads on how they want to approach it and working with their teams on the best way to do it. First of all, there's no wrong way to do this. I want you to be clear about. I want to be clear about that. And even if you're not particularly comfortable with a bill, that's okay. You telling your story and your experience actually has a lot of value. And the other thing that I'm personally very proud of is over the past 2 years, we've really started to build a reputation with Congress of the organization to go to when you need patient stories. And the thing is, your story may, at this exact moment, may not fit into something that's going on in Washington. That's okay. It doesn't mean in 2 months it won't. And so I just say that to say it's always going to be relevant. It's always needed. And trust me, the coolest thing is when I get a call from a member of Congress's office asking for patient stories. That's really amazing.
Okay.
All right, let's Jolie, I think you had your hand raised. Sorry, I'm trying to. Oh, why can't I do this? For some reason I can't take it off mute. Maybe. For some reason I can't take you off mute. All right, we're gonna see if we can get that fixed because I'm not sure what's problem there. And I will come back to you. I apologize for that. All right, any other questions really quickly? If not, oh, let's see. Q&A. So I did get a question, so Robert said Medicaid is everyone is all everyone in the Hill wants to talk about right now. So I'm actually going to disagree with that. I think it's going to vary. It's going to depend a lot on the office that you meet with. And that's actually one of the reasons why we're approaching it the way we are, because number one, I think there's elements because no one's talking about anything else that actually will make us a little bit more memorable because of that. But also, I think, listen, we have to acknowledge the situation as it is. The Democrats are the party that's the minority right now in both the House and the Senate, and they're frustrated by that. And anybody that's a minority party is frustrated. It stinks. And so listen, their focus is going to be different because they gotta try to make an impact where they can, just given the rules and this process and the fact that it only requires 51 votes. The other thing that I'll point out too, though, is on the Republican side, nothing's a sure deal because there's only 53 Republican senators. They need 51 votes. Ron Paul's a no, so that already brings them to 2. And then there's a lot of different people with different opinions in the Senate. So nothing's a slam dunk here.
I'm not sure if this is working yet.
This is a great question. Is NIH funding part of the reconciliation package? So the answer to that is no. And I will also say the NIH funding is one of the things that I have found to be the most challenging to understand what's going on. And so I wish I could give better information, better clarity. And this is one of my biggest frustrations is that it's very hard. Um, the communication on this stuff has not been great. I'll just put it that way. But what I will say, and this is where this gets confusing because a lot of times we are talking about a lot of different bills that involve money. Back in December, we were talking about a bill that was involving money. Now we're dealing with another one, and frankly, we will deal with another one this year too. So what will happen is this budget reconciliation bill is, I would think of it as a long-term plan, a long-term blueprint. What still has to happen is Congress still has to put together an annual budget. So every year they have to go through and they have to figure out how they want to spend the money in different places. And that is unless there is a chance I'm somewhat wrong here, but I from what I can tell you, that would happen really in the appropriations process, which will happen a little bit later this year. Oh, thank you, Levi. I appreciate it. Are there any bills that address rehabilitation facilities? It seems that after any major surgery, hospitals will send you to rehabilitation short hospital stays. So this is a good question. I think I need to get back to you on this one. I think there is a small provision that addresses this, but I've also been reading a lot of stuff lately, and so I don't want to say that with complete certainty. Let me look into that and get back to you. Right. All right. If everybody is amenable, I am going to go through the other bill. So just kind of recap how this is going to work. Again, I do not expect anybody to have their head around every single one of these. That's my job. And there's a lot of work we do afterwards to follow up with offices and stuff like that. So I don't want you to feel like it's on you. Um, Billy, can you take yourself off mute? Oh,
Okay,
I can't get. Oh, there
can
we
you hear
go.
me?
Yeah.
I'm not sure what happened there. I'm sorry. I had a simple question about our trip on the patient education day prior to Hill Day. Are we going to be going over the bills at that time?
Yes. So this is my plan. So we have tonight. I'm also willing to do another one of these. We're doing our best to get the team leads up to speed so they can help with you. And then yes, we will have opportunities where we will go over this stuff both during the day as well as opportunities to meet with the team leads. And we've also discussed maybe adding in because I do know there's been a lot of people asking about this, and I understand. So we may add an additional opportunity to meet up to talk about it. We just have to figure out where that fits into the schedule. But yes. All right. So I'm going to. Oh no. I'm having a rough day here. All right, here we go. All right. Oops. Okay, so just to kind of go back, so we'll have a little bit, we'll have like one document that kind of again kind of goes through this reconciliation bill and gives some suggestions on the update. The other thing we'll have is a document that are going to be bills that nobody in the Congress is going to have the brain power to get their head around at this moment. We acknowledge that. And that's okay. But we want to use it as because they're bills that we really care about. And frankly, normally they would probably be the bills that we focus on. It's just this just happens to this whole process seems to be happening during our fly-in. um, we want to use this as an opportunity to create uh, a chance to follow up with the members of Congress, in probably a month or two when they've finished up dealing with these big bills and try to maintain that connection to talk about other bills that we care about a lot. So that's really the big ask that we're going to make is can we follow up with you in August or September to talk about some of our other priorities as well. And we will leave behind a document that goes through all of those bills. And that's why you don't necessarily have to know all the ins and outs. If there's one that you get, that's great. Um, so one that we really like, and I think I mentioned this, this it's the health. That's not what it's called. Yeah, the Health Savings for All Act, Hope Act. I don't know. That doesn't work, right? I don't know how that works. Anyway, it's called the Hope Act. I think I made a typo somewhere. It is sponsored. It's a bipartisan bill. Um, and what it does is it basically takes the concept of the health savings account but it removes the current restrictions, and they're sort of rebranding it a health savings account and calling it a HOPE account. And so this would basically extend effectively an HSA to nearly everybody that's on a qualified health plan. So basically, if you don't have a health plan, you'd be the only one that's not on it. And the cool thing about this is it's not just commercial plans, it's Medicare, it's Medicaid, Indian Health Service, et cetera. It's really trying to be as inclusive of everybody as it can be. It is the great thing about health savings accounts are they're tax free. The money going in isn't taxed. The money going out isn't taxed. The only catch is it's got to be for qualified medical expenses. The annual contribution limits would be $4,000 for individuals and $8,000 for families. And like I said, it's a bipartisan bill. We're really excited about this bill. This was going to be our lead bill this year. It's just the process got a little mixed up. And what we really like about HSAs is they do two things. And I know there's a question about bills that help lower costs. Part of the belief is giving people a little bit more control over the healthcare dollars, and the spending will actually force more competition that will help lower prices. This was not the whole solution. I don't want to promise that, but this is one element that will help get costs lower. And more importantly, it'll help stretch your healthcare dollars further. And if you have a serious medical event down the road, if you saved or invested, it can be used for that as well. All right, the other act. So I talked about PBMs, pharmacy benefit managers. This is a bill that's very similar to what I was talking about in Medicare and Medicaid in the reconciliation bill. The big difference here is this would apply it to commercial plans. So because of the rules around reconciliation, that bill cannot address commercial plans because it's not related to Medicare and Medicaid. So this is an opportunity outside of that. This is another bipartisan bill that we were behind last year. We continue to be behind this year. This is sort of the big PBM reform bill. It again, the thing that I love about it, and I think this is the biggest selling point, is it allows the patient to actually participate in the savings. So when these PBMs negotiate the rebates with the drug manufacturers, this bill would say that they have to pass those discounts and savings along to you when you purchase the actual medicine. The next bill is called the Doc Access Act. It is another bipartisan bill with Representative Buddy Carter. Just to give you some context on Representative Buddy Carter, he is the chair of the House Health Subcommittee on the Energy and Commerce Committee. So he's an important guy. He's also a pharmacist. So he tends to really understand these issues very well. Yvette Clarke from New York, she's also a fantastic member of Congress, and she's the chair of the Congressional Black Caucus. So this is a great bill, got two great leaders on it. And we'd love to get a version of this in the Senate. So dental and vision benefit managers are sort of like pharmacy benefit managers, but obviously they're focused on dental and vision benefits. They also do enact a lot of practices that really limit patient choice. They are vertically integrated. So what that means is they have sort of a big health business, like a health plan, and then they have maybe if it's like for vision, they'll have like a glasses manufacturer, they'll have their own lab, et cetera. And so they try to steer you into every part of their process. So they're making the money off of you, and they're not allowing you to have the choice in that. This really empowers you to sort of have choice over what type of glasses you want or the type of dental care. Allows the dentist or the optometrist to go back to the days of actually serving you based on your need, as opposed to whatever's listed in the contract that the dental or vision benefit manager put in place. And so the challenge with this bill is not the bill itself, but it took probably 10 years, if not longer, to get Congress to understand what pharmacy benefit managers are. We're just starting to talk about dental and vision benefit managers. So that's the biggest uphill climb on this, is just creating awareness so people understand that all these different benefit managers exist. One thing that I've learned since I've been doing this, there's a benefit manager for everything. It's crazy. There's dialysis benefit managers. There's all these like little fringe cottage benefit managers that decide how prior authorizations work. It's pretty nuts. So this next bill is a bill that I love. Full transparency, this bill is not going anywhere. I know it. I'm letting you know it. But I love the spirit of the bill. The reason I know it's not going anywhere is there's only one sponsor. There's no co-sponsors or anything like that. But this is an issue that we actually think is really starting to emerge. So the whole idea around nonprofit hospitals was that you're treating them as nonprofits because they were built to serve their communities, and particularly the most vulnerable in their communities, and providing services to those communities because they may not be able to get the investment of a private hospital, for example. We think that social contract has been broken. There's been a lot of studies that have been emerging in the recent months from both, I would say, conservative and liberal think tanks and policy groups that are starting to look at how much tax benefit these nonprofit hospitals get versus how much they give back to their community. And so what this does is amend the tax code to really better define the type of community benefit that they're expected to give back to their community, and in particular define kind of what charity care is and what kind of services they're supposed to do. It gets the community board involved to have some accountability on if they're actually meeting the community's needs. And if they're not, it could actually go as far as revoking their their tax advantage status. So again, this bill is not necessarily going anywhere, but we see it as I think I think she may be ahead of her time on this. I think I might be ahead of the time on this, but I think this is going to be an issue that starts to grow. We're starting to see a little bit more focus on it in the state level, and that's typically an indicator. A lot of stuff usually starts to happen in the states before it really gets taken up at the federal level. So, all right. Oh,
So I
oh,
would be interested in staying abreast on that specific topic that you just discussed with the nonprofit status of the hospitals, because we are I just read some articles recently with regards to the clinic here in Ohio, and that was one of the things that they discussed. They ranked very low with regards to how much is given back to the community and the underserved, and so I would like to see that play out. There has been a class action lawsuit filed against the hospital just in the last week with regards to how patients are treated. So I'd like to see that actually move, because I think that they are given millions of dollars. And there was an article, quite a few articles telling how they, with their ranking and the lack of support for the community and
yep.
then the neighborhood that they could serve. So I don't think that that's that far off when you look at the type of money that they're receiving in tax bracket as a nonprofit entity, and the fact that the taxes that they're not paying is, I mean, they're in the billions of dollars.
I think we're going to
And
be best friends. I think you and I are going to get real close.
so I would definitely like to see that. I mean, when I read the article, I was like, wow, they're not producing. And as a person who grew up in the neighborhood when it was just one brick and mortar building, attending it with my grandmother for diabetic recheck, and now it has a whole campus that's like 20 blocks in length,
Yeah.
and then you don't even serve the community. Um, and the big thing right now again is the copay. They were saying that, if you didn't come in with your copay in hand, they weren't going to see you. They were going to make you reschedule your appointment. Well, we know that when you make these appointments that you're already 6 months out as it is,
Mhm.
trying to get the appointment. So I didn't, they've since rescinded that statement because of the action was placed against them with the lawsuit, and they got a lot of media attention with regards to that. And I think it's such a shame that those of us that are vulnerable with chronically ill and with rare, and the amount of times that we visit the doctors and we're expected to pay these astronomical co-payments each time we visit. For the month of April and May alone, I'm at $500 in
Mhm.
co-pays.
Yeah, I'm with you on this one. And
Yeah.
I mean, the challenge with this is it's a challenge with healthcare across the board
Yeah, this country is just built on greed.
well, so I have this saying that I'll share. So, our system's based on everybody spending everybody else's money and taking a cut along the way. And so
Mm-hmm.
everybody's invested in getting higher prices because that's how they make money. And that's unfortunately this fly-in, and I would say in the next 12 months, I'm not going to solve that problem, but
Right.
we very much believe that we need to completely rethink how we fund and finance healthcare because the incentives just don't make sense. I think the incentives probably made sense in 1950s when a lot of these things came into place, but
And
science,
when you
tech.
have people not living as long as well.
Correct. Correct. And science, technology, medicine has advanced so much since then.
Mm-hmm.
And not to mention uh the American population's changed so substantially as well. And so, what makes sense is, and this is what we kind of believe to our core. It's just it's gonna be hard to move this, you have to move this along in little pieces, is can we create an incentive structure that actually pays people to keep people um to improve their long-term health and well-being, right? As opposed to just focusing on trying to manage costs over a calendar year.
Right, right. Yeah, that's true.
Oh, thank you. I appreciate that. I need the support. Um, so that I have two more, and then I can kind of wrap up. So this bill, I forgot to put the House number on here. I apologize. So this is a bill that we have in both the Senate and the House, and that may be a question that some of you have: is how come there's no senators on a lot of these bills? Well, again, the Senate's a little different. In an ideal world, we do have bills in both the House and the Senate working together. Senate sometimes just takes a little bit longer, and that's often the case. So this bill, so the other weird thing about this bill, just so everybody is aware, is, and I don't exactly understand how this happened, but somehow it got combined with a bill involving cancer in children, and I don't really know much about that bill. I'll be honest. And I was actually in an office with a member of Congress because I was trying to get this bill passed because we were focused on getting this priority review voucher for the FDA for rare disease passed, and so anyway, I was very focused on this, and I was asked, well, what about the kids with cancer? And I was like, I'm sure it's a worthy cause. I just don't know anything about it, but. Anyway, this is a very important bill, particularly for the rare disease community, particularly for the moms and dads that have children with rare disease. There's so many rare diseases; it's very hard to invest in the science because there's so many and there's so few people, that this actually creates an incentive for scientists and medicine developers to invest in more pediatric rare diseases. And what it does is these vouchers allow the sort of a fast track process through the FDA to get approval if they're successful. And the other interesting thing is the vouchers can be sold. And so this has actually been a really effective way to get more investment in rare disease drug discovery. And it has been successful in getting approvals done. It's sadly, this program expired in December because of just some, well, it's Congress. They do dumb things sometimes. And that's really the answer. They just screwed up. Um, and so we're asking to have this reauthorized because it was already a program that existed. It's just expired. And so we want to get that back up and running. And then this bill's a new bill to us. It's called the Health Tech Investment Act. It is around technologies that artificial intelligence associated and algorithm-based healthcare. And I don't want you to think of Terminator or ChatGPT. Well, maybe ChatGPT a little bit, but this is really medical devices or technologies. It's not. It's not, we have some concerns about like AI on insurance claims and stuff like that. This is more products that to help improve health. They're FDA approved. The problem right now is just because they're new technologies, Medicare is not set up with a reimbursement system to pay for these. And so this creates a 5-year payment window that works for uh, the technology companies so they can invest in future product development, but it also allows them to collect data to demonstrate the value to make sure that it's actually meaningful to the people that's serving, so it can set it up for long-term reimbursement. This bill was recently introduced, I think, in the past month. Also bipartisan bill, and it starts in the Senate, which that's actually a really good way to start. So it's bipartisan. Senator Mike Rounce from Montana and Senator Heinrich from New Mexico. I think that's all my bills. And I know that's a lot. I'll be the first to acknowledge it. Let me see. Got anything? Oh, Bill, let's see here. Okay, so Bill shared a video. Please take a look at his video. Yeah. All right. All right. Any last questions for me, for the panel, for anybody? Thank you, Lucinda. I appreciate you. Actually, I want to catch up with you too, separately. Yeah, that's the thing is like it's crazy. Like I know so many of you already, and like Charlene's and I are already best friends. This is great. I love this group. This is why I do it.
Okay.
All right. Folks on the panel, any last words of wisdom before we leave?
No, I'm excited.
I'm excited. I'm excited. You're excited. That gets me fired up.
Okay.
All right. All right. Well, with that, I'm going to thank everybody for your time. I apologize for going over, but I think it was time well spent. I don't want anybody to have anxiety over these meetings, these bills. We're here for you. And it is a lot. We know it's a lot, but we are going to support you to do this in a way that works best for you. It looks like I may have gotten one last question. Where did it go? Oh, Roberta, do you have a question or no? Maybe, maybe not. Oh, thank you guys. Thank you, Demi, Madison, everybody. All right. Well, I will give it 1, 2, 3 more seconds. All right. I want to thank everybody for participating tonight. I hope you learned something. I hope you got jazzed up about working more with us. Seriously, we all love working with you guys. One thing about Patients Rising, it's serious business, but we also like to have fun. And I hope you guys get a feel for that too. We aren't afraid to make some jokes and have some lively conversation, have some fun events. So my hope is those of you that are coming to Washington, it's a great experience for you. Those that for the first time, we hope that we make it memorable for you. We hope that we get some good work done, but I think most importantly, we get good work done and having fun while doing it. So look forward to seeing everybody in Washington. And those I won't see, I'd still love to catch up with you guys and just talk about how we can work together in other ways too. So thanks, everybody. I hope you have a good night. As a New York Knicks fan, I don't know what the score is, but let's go Knicks.
Yes, let's go Knicks.
Yeah.
Pacers.
See?
Go Pacers.
Oh, no.
Oh gosh, no.
All right. Good night, everybody.
We're in New York all day. All right.